Hi everyone, welcome back to our channel. Please like, share and subscribe our channel. Today we will discuss about the most important topic for the nursing exam point of view. Most important MCQ, shock. First question, which of the following is the earliest sign of the shock? Option A, hypotension. Option B, restlessness and anxiety. Option C, oliguria. Option D, cold, clammy skin. The answer is option B, restlessness and the anxiety. Early hypoxia in shock first affects the brain, causing restlessness and anxiety before other vital changes occurs. Next, in hypovolemic shock, the primary cause is option A, myocardial infarction. Option B, loss of circulating blood volume. Option C, severe infection. Option D, spinal cord injury. The answer is option B, loss of circulating blood volume. Hypovolemic shock results from the loss of intravascular fluid due to hemorrhage, burns or the dehydration. Next, the hallmark sign of septic shock is option A, bradycardia. Option B, low urine output. Option C, warm flushed skin. Option D, pulmonary edema. The answer is option C, warm flushed skin. In early septic shock, vasodilation causes the warm flushed skin due to endotoxin release. So the answer is option C. Next, the best indicator of tissue perfusion in shock is option A, blood pressure. Option B, heart rate. Option C, urine output. Option D, skin temperature. The answer is option C, urine output. Kidney perfusion reflects systemic perfusion. Oliguria causes the less than 30 ml per hour. It indicates the inadequate perfusion. So the answer is option C. Next, which IV fluid is most commonly used initially in the hypovolemic shock? Option A, 5% dextrose. Option B, Ringer's lactate. Option C, normal saline. Option D, 25% albumin. The answer is option B, Ringer's lactate, because Ringer lactate is an isotonic solution. It restores intravascular volume and maintains the acid-base balance. So the answer is option B. Next, in cardiogenic shock, the main pathophysiology is option A, decreased vascular tone. Option B, loss of blood. Option C, pump failure of the heart. Option D, neurogenic vasodilation. The answer is option C, pump failure of the heart, because cardiogenic shock is due to heart's inability to pump effectively. When heart can't pump effectively, it causes the cardiogenic shock. Next, in anaphylactic shock, the first line drug is option A, dopamine. Option B, epinephrine. Option C, atropine. Option D, hydrocortisone. The answer is epinephrine or the adrenaline. So the answer is option B, because epinephrine counteracts the bronchospasm and the vasodilation in the anaphylaxis. So the answer is option B. Next, in shock, lactic acidosis occurs due to hyperglycemia, Option B, increased oxygen delivery. Option C, anaerobic metabolism. Option D, increase the urine output. The answer is option C, anaerobic metabolism, because inadequate tissue perfusion leads to anaerobic metabolism, producing the lactic acid. So the answer is option C. Next, neurogenic shock is characterized by option A, tachycardia and hypotension. Option B, bradycardia and hypotension. Option C, warm dry skin with the hypertension. Option D, cold clammy skin with the tachycardia. The answer is option B, bradycardia and the hypotension, because loss of sympathetic tones causes the vasodilation and the bradycardia. So the answer is option B. Next, which laboratory finding is the most consistent with the shock? Option A, increased the PO2. Option B, decrease the serum lactate. Option C, metabolic acidosis. Option D, respiratory alkalosis. The answer is option C, metabolic acidosis. Option C is the correct answer, because shock decreases the tissue perfusion and leading to the anaerobic metabolism and the metabolic acidosis. So the answer is option C. Next, compensatory mechanism in the early shock includes all except option A, increased the heart rate. Option B, peripheral vasoconstriction. Option C, increased the urine output. Option D, activation of renin angiotensin system. The answer is option C, increase the urine output, because urine output decreases due to the renal hypoperfusion, not increases, it decreases. So the answer is option C. Here they asked the all except. So the answer is option C. Next, the most specific sign of hypovolemic shock is option A, tachycardia. Option B, low urine output. Option C, hypotension. Option D, narrow pulse pressure. The answer is option D, narrow pulse pressure, because decreased the stroke volume leads to narrowing of the pulse pressure, a key indicators. So the answer is option D. Next, disseminated intravascular coagulation is most associated with option A, hypovolemic shock. Option B, septic shock. Option C, neurogenic shock. Option D, cardiogenic shock. The answer is option B, septic shock, because endotoxin in septic shock trigger the widespread clotting leading to the DIC. So the answer is option B. Next, which type of shock can occur after the spinal anesthesia? Option A, cardiogenic shock. Option B, hypovolemic shock. Option C, neurogenic shock. Option D, septic shock. The answer is option C, neurogenic shock, because spinal anesthesia can block the sympathetic tone, causes the neurogenic shock. So the answer is option C. Next, which vasopressor is the commonly used in the septic shock if fluid resuscitation fails? Option A, noradrenaline or norepinephrine. Option B, epinephrine. Option C, dobutamine. Option D, atropine. The answer is option A, noradrenaline, because noradrenaline or the norepinephrine is the first line vasopressor for the septic shock after the fluids. Next, the irreversible stage of shock is characterized by option A, hypotension reversible with the fluids, option B, metabolic acidosis with oliguria, option C, cellular death and organ failure, option D, compensatory tachycardia. The answer is option C, cellular death and organ failure, because in irreversible shock, tissue damage is permanent, leading to multi-organ failure. So the answer is option C. Next, the first nursing action for a patient in hypovolemic shock is option A, administer oxygen, option B, start IV fluids, option C, place patient in the Tyndall birth position, option D, monitor the urine output. The answer is option A, administer the oxygen, because oxygen is the prioritized to prevent the hypoxia, while other intervention are the prepared. So the answer is option A, administer oxygen. Next, which of the following is not a type of the distributive shock? Option A, septic shock, option B, neurogenic shock, option C, anaphylactic shock, option D, hypovolemic shock. The answer is option D, hypovolemic shock. Option D, because hypovolemic shock is due to blood or fluid loss. The others are the distributive. So the answer is option D. Next, which of the following indicates successful fluid resuscitation in shock? Option A, heart rate 120 per minute, option B, blood pressure 80/50 mm of Hg, option C, urine output 35 ml per hour, option D, cold clammy extremities. The answer is option C, urine output 30 ml per hour. Adequate urine output indicates the improved renal perfusion and the resuscitation. So the answer is option C. Next, which is common complication of prolonged shock? Option A, renal failure, option B, hyperthyroidism, option C, hypertension, option D, liver regeneration. The answer is option A, renal failure, because prolonged hyperperfusion causes the acute kidney injury. So the answer is option A, renal failure. Next, in cardiogenic shock, which drug increases the contractility without increasing afterload? Option A, dopamine, option B, dobutamine, option C, noradrenaline, option D, atropine. The answer is option B, dobutamine, because dobutamine improves the cardiac output by increasing the contractility with minimal effects of afterload. So the answer is option B. Next, a patient with the anaphylactic shock develops stridor. The nurse's immediate action is option A, start IV fluids, option B, give hydrocortisone, option C, maintain airway and give the epinephrine, option D, start the dopamine infusion. The answer is option C, maintain the airway and give the epinephrine, because maintain the airway is airway and epinephrine are the prioritized in anaphylaxis. So the answer is option C. Next, which shock is associated with relative hypovolemia? Option A, hypovolemic shock, option B, neurogenic shock, option C, cardiogenic shock, option D, obstructive shock. The answer is option B, neurogenic shock, because vasodilation causes the pooling of blood leading to relative hypovolemia. So the answer is option B, neurogenic shock. Next, which electrolyte imbalance is most common in shock patient receiving blood transfusion? Option A, hypocalcemia. Option B, hypernatremia. Option C, hypokalemia. Option D, hypermagnesemia. The answer is option A, hypocalcemia. Option A is the correct answer because citrate in stored blood binds the calcium leading to hypocalcemia. So the answer is option A. Next, the gold standard monitoring for the cardiogenic shock is option A, non-invasive BP. Option B, ECG monitoring. Option C, pulmonary artery catheter Swan gauge. Option D, urine output. The answer is option C, pulmonary artery catheter, because it measures the cardiac output and feeling the pressure directly. So the answer is option C. Next, which sign differentiates septic shock from the other shocks in the initial phase? Option A, tachycardia. Option B, bounding pulse and warm skin. Option C, hypotension. Option D, oliguria. The answer is option B, bounding pulse and the warm skin, because vasodilation in early sepsis causes the warm skin and the bounding pulse. Next, in obstructive shock, which condition is a common cause? Option A, cardiac tamponade. Option B, severe dehydration. Option C, myocardial infarction. Option D, anaphylaxis. The answer is option A, cardiac tamponade, because obstructive shock occurs when external compression prevents the cardiac filling. So the answer is option A. Next, in hypovolemic shock, capillary refill time is option A, less than 2 seconds. Option B, 3 to 5 seconds. Option C, greater than 5 seconds. Option D, not affected. The answer is option B, 3 to 5 seconds. Prolonged refill time indicates the poor perfusion. Next, which position is recommended for the shock patient except the cardiogenic? Option A, Trendelenburg position. Option B, supine with the leg elevated. Option C, semifibulous. Option D, sitting upright. The answer is option B, supine with the legs elevated, because it improves the venous return and the cardiac output. So the answer is option B. Next question, which is the most important initial diagnostic test for the patient in suspected septic shock? Option A, ECG. Option B, chest X-ray. Option C, blood culture. Option D, ABG analysis. The answer is option C, blood culture, because identifying the causative organism guides the antibiotic therapy. So the answer is option C. Thank you everyone. Please like, share and subscribe our channel.